COVID-19 vaccine rollout is taking some time to speed up. The CDC says only about a quarter of the COVID-19 vaccine doses distributed to North Carolina have actually been administered to people.
Our Capitol reporter Michael Hyland is live in Raleigh getting answers about why. Michael.
And this website from the CDC lets you track all this. And we found North Carolina lags behind many other states when it comes to the percentage of doses that have been distributed here have actually been administered to people. And so we found out some more about the logistical issues behind that.
So you didn't even feel it, did you?
This week, North Carolina is moving into phase 1B of its COVID-19 vaccination rollout. That means people 75 and older will qualify. But much of the state is still trying to get through phase 1A first, including vaccinating people at hospitals working with COVID-19 patients.
There's not a quick and easy snap your fingers fix to this.
The CDC reported Monday that North Carolina has administered about 25% of the doses received so far. That's behind the country as a whole, which has administered about 29% of the doses distributed. In a handful of states, more than half of their doses have been administered. Tatiana Kelly is with the NC Healthcare Association, which represents the state's hospitals.
There's a couple of limiting factors. One, the amount of time that it takes. Two, that we're tasking the same workforce that's treating COVID patients also with a vaccination rollout.
She says hospitals are trying to stagger when they vaccinate employees who are already dealing with record numbers of patients battling COVID-19.
You don't want to vaccinate everybody all at the same time, because if there are after effects and people have to stay home to manage those symptoms.
She says a lag in reporting data could also be a factor in the numbers. Surgeon General Jerome Adams was asked about the slower than expected rollout on CBS this morning.
Other states haven't even used 25% of their vaccine that's on the ground. So what we're doing in a concrete manner is we are actually looking jurisdiction by jurisdiction from a federal perspective, and we're going to start moving those doses around.
I just heard back from the State Department of Health and Human Services late this afternoon. They say they've sent a letter to hospitals and local health departments across the state that future allocations of the vaccine are going to be modified based on the number of vaccines that are actually administered and reported back to the state. And they say there's also been some anecdotal evidence of some people in phase 1A declining to get the vaccine. They're also trying to get some more providers as well. Live in Raleigh, Michael Hyland, CBS 17 News.